Good evening, and thanks for joining us. I'm Dr. Jim Heise, Chief Medical Officer here at Door County Medical Center. I'm joined with Chief of Pediatrics, Dr. Amy Fogarty. Thank you for joining us.
Of course.
And we're going to talk about all things COVID-19, families, kids, issues with schools. We thought it might be a good opportunity to once again sit down and answer questions that you might have related to that. I know we've now had a good, 3 months in school?
2, yeah.
2 months in school. And obviously, there have been ups and downs and things like that. But overall, at least from my perspective as a parent, it feels like it's gone better than I thought it would have gone. Just from the logistics, if anything else. So we're going to kind of see what questions you have, and we'll be here to answer them. So I'm going to turn it over to Amy if you have any topics you want to start talking about.
Well, I mean, the school year has been going actually very well, very smoothly, especially in the past couple of weeks. I think everyone's gotten a little bit of experience, and we've gotten the logistics down a little bit better. I think the things that have made a really big difference, obviously when the hospital testing is up, that's really helpful, and our ability to give priority to school-age kids so that we can test kids that are having ill symptoms and then get them back to school has been really helpful. The nurses and the school staff getting contact tracing down has been good. Although I definitely do not want to undermine the choices that you guys are making as parents. It's made my job and the school's job much, much easier. I know sometimes there's an instinct to say, it's just a cold, I really need to work today. And we've been seeing a lot less of that. And so in the families that I'm calling with positives, we've had to do a lot less contact tracing. There's been a lot less close contacts that have been sent home from school, both kids and staff. And that's really been helpful because that's really allowed us to keep schools open. Even for kids, when we send them home, we say, well, is it really that big of a deal that they missed some school? Well, then you have to always think about the parent that has to be home, right? And the parent that's missing work that has to then supervise that child. And so there's lots of downstream effects when we have those close contacts. So the more we can minimize that, the better we do in terms of keeping schools open. Again, I've been calling all the positives for kids that are under 18, and happily, for the vast majority of the cases, they're mild symptoms, things that certainly would not have probably even come to the attention of a doctor in any other year. But parents making the right choice and saying, it looked just like a little bit of a runny nose, or it was a mild cough, or they just had a fever one night, but then getting those tests and keeping those kids home from school has been really helpful. We are joking a lot up in our office that yes, you're allowed to have a cold, or yes, it's allowed to be allergies only after you have your negative COVID test.
Right, that's right.
So, and because the symptoms are mild, those are the times that we need to get the test. And I think the other thing is, I know, as far as I'm concerned, I just want to thank all of the parents and families, and I try to do that in the people that I'm calling back, but for making the right choice. I know it's, I kind of liken it to taking one for the team, right? So when you keep your child home when they have mild symptoms and brothers and sisters, when the test comes back negative, you feel like, well, that was a couple days of school that they missed. When it comes back positive, though, and knowing you made the right decision, it is just immensely helpful. And if all the parents work together to make the right choices, then we are much more able to keep the schools open on a consistent basis for in-person instruction, which everybody wants to have in-person, nearly everybody, right? The vast majority of parents wants in-person instruction. And so by doing that and making those right choices, I think that's honestly one of the things that's made the biggest difference in the last several weeks. We've gotten out of situations when we've had, meetings about, are we going to have enough staff? If one more staff goes down, we're going to have to close buildings or grades. And so that's been fantastically helpful. And having everybody really working together has really made schools be able to stay open. And in doing so has allowed parents to stay at work too. So there's a lot of good things that come with that. So I want to thank everybody that's making those hard choices, because I know they're hard choices when you're in the middle of it.
I mean, this year too, it's I know for me, it's for my son, I mean, it's and Dr. Fogarty can speak to that too, having a doctor for a parent is maybe kind of depends on the day, but it can be kind of a sucky experience, because for me it's sort of like, oh, you have a sneeze, so what, no big deal. And I had not said that this year. So thankfully my son has had no symptoms at all, but it's the same thing. We're sort of used to saying, throw some dirt on it, it'll be okay. And not this year.
Yep.
As you said, I mean, one of the things that I've been harping on a lot is the fact that it doesn't take much. I mean, if all of a sudden you have just what seems like allergies and you end up being positive, you look at the amount of people that have been affected. Just the downstream effects are really something. And it's never intentional, but it just is the reality of what we're dealing with. So actually, Melanie has a really good first question. If a child is sent home for being in close contact but shows no symptoms in the 2 weeks, do they need to be tested before going back to school?
So required, no. Strongly recommended, yes. So the schools will let you back in if you've, we kind of use these interesting words now, served your quarantine.
Right, yeah.
Get out of COVID jail, right? So I have a lot of families that are using these words. But so if it's 14 days, getting tested and having a positive or a negative test doesn't necessarily change your quarantine time. The reason that we like the reason that we like people to have tests on that day 7 or whenever they develop symptoms is it's really twofold. So the first one is the altruistic reason, which is because we want to know if you've had additional close contacts, because obviously if you test positive, then that's one more ring out that we need to go to make sure that people are quarantined, and we want to make sure we're quarantining the right people at the right times. The selfish reason to get tested is because if you do come back positive, so there's this little fine print. Dr. Heise and I have gotten really good at fine print, right? Down at the bottom, it says if you test positive for COVID, then for 90 days after your positive test, you're deemed to have antibody levels that are high enough to keep you from having to, I guess it's another get out of jail free card, right? So it's a free pass. If you're deemed a close contact with another case, or if your child has a little bit of a runny nose, we don't have to retest them, those sorts of things. So for 90 days after that, you don't have to do those things. So like most of the things we're talking about, there's sort of the selfish and then there's the altruistic reason, both of which are good reasons. And right now we have good testing, so we get those results pretty quickly. So those are the reasons that there's that recommendation that you're getting from public health and from school nurses to be tested even without symptoms.
Yeah, I'll give you kind of an interesting example of what can happen. So I'll just use personal example. My son in middle school became a close contact in September. He was a close contact. He and a number of others were sent home as close contacts. So he was told he had to be home for 2 weeks. And do in-home the virtual schooling, which thankfully, Lee Sturgeon Bay, they've done a really good job of getting that up, and they're doing a great job. So that was okay. But then he had to get tested actually in 7 days. 7 days into that, he got tested. Lo and behold, he was positive. He had no symptoms whatsoever, but he was positive. So that instantly made me and my wife close contacts. Now here's the fun part. So you say, oh, okay, we're close contacts. We have 14-day quarantine. Well, if you live with someone, as you do obviously with your child, it is not 14 days. You have to end the child's quarantine and then you go in to 14 days. So it's a 24-day. So it's really interesting. Now we have ways that we deal with it for vital employees. I had to work, so we have ways to deal with it for healthcare workers. But my wife sort of jokingly said, I'm stuck in the house for a month, essentially. Yeah. So it's interesting how this all goes. And so in that context, when you get that get out of jail free card, that 90-day, if my son all of a sudden got the sniffles or something like that, we'd be able to say, yeah, this is probably no big deal. Yeah. So that there's a lot of benefit to that. And for us, thankfully, it was not that big of a thing. Had it been someone who's paid hourly and might not have all that much sick time, that can be a real hardship.
Yep.
And we want to try and avoid that.
Well, and for those of you that were checking Dr. Heise's math when he was going through the 24 days, so if you test positive, it's a 10-day quarantine.
Correct.
So that's why his sons went from 14 days to 10, because he did test positive. So it's 10 days. And then in Daniel's case, you could kind of do the shifting a little bit, because it's 2 days before he tested positive is when his 10 days start. So, so Mrs. Heise was out for
It was a
good long while.
And it was an interesting,
It was a good long while.
interesting calculus because I mean, I call positives all day long for adults, and sort of give the rough lay of the land, and then public health takes care of the rest. But when they called and they said, here's the specific dates you need to follow. So.
Yeah, and parents can file for the CARES Act, that's 10 days.
Yeah.
And so that's a federal program that will take care of your wages, but that's 10 days and can only be used once. Mm-hmm. So that's when you're talking about all these days, it's a big deal. It is. And again, why we appreciate so much when parents are making the hard decisions to keep kids at home, because they are hard decisions. They truly are.
And Melanie has a follow-up question, and I love it. I'm going to read just the way it says. Do they still shove it way up your nose, or is there a less invasive way now? That's a great question.
Right. Yeah, so I know. Don't you always love that? I feel like these answers are always, it depends, right?
Yeah, right.
And it does. So right now for the machine that the hospital is using, we're using the T2, which some of you may have heard of. And that is a nasopharyngeal swab. So it is the way up your nose. Now I will say this. So two of my 4 have been tested in the past couple of weeks here. And both of them said it was, they hear from their friends too, all this, we're going to your brain and all of these things that kids will say. And both of them said, it's not, let's sign me up to do this 10 times a day, but it was also not the worst thing in the world. Yeah. We do them on kids in our clinic, babies even, we've had as young as 3 months old, I think was our youngest. And, it is not pleasant, but it's also not near. I would say it's probably not nearly so bad as what some people imagine it to be. It's eye-watering and it's noxious, but it's not.
And I've had it done too, related to my son, and it really wasn't that bad. And I'd never had one done. I always, when I used to do it, because that's the way you test for influenza too. When I used to do it in my clinic years ago, I would tell people it's not painful, but it's obnoxious.
Yep.
And that's kind of what it is. And what's interesting for those that don't know is you sort of have this idea that you're going up the nose. Everyone thinks it goes this way. Actually, the nose goes straight back. So you go. That's why it's a nasopharynx. The pharynx is the back of the throat back here. So you're going straight back all the way to the back of your throat, and you twist it around. And so we sort of joke and say it's a brain biopsy. But again, I had it done, and it really is not that bad. My eyes teared. I kind of coughed a couple of times. But this too shall pass, as I always say. So. And Susan Johnson brought up Door County Community Foundation and United Way Door County have an emergency response fund to help families in need. So that's good to know. So so far no more questions, and so if you've got any, feel free to answer, and we'll feel free to ask rather, and we'll keep on kibitzing. Want to talk about Halloween? Yeah,
it's coming up, right?
Yeah. Mm-hmm.
Saturday. Sturgeon Bay is still having technical trick-or-treating hours from 4 until 7. Mm-hmm. The Department of Public Health has put a very nice link on their website about recommendations for Halloween. Children's Hospital of Wisconsin also has one that we've been handing out in our clinic. The question mostly comes up around trick-or-treating, right? And that's a little bit of a hard one because it kind of depends on how it's done, right? So there's lots of, I'll say kind of cute, I think they're cute, ways to do safe trick-or-treating with the candy shoots and the bags kind of scattered about. And those are not bad ideas, right? So if we can keep people, if you're in your family unit, hear what you said. And we're, keeping people 6 feet apart, then I think that's a reasonable thing to do. We certainly don't want big groups of kids, which is in years past, that's how it's been done in my neighborhood, right? So we see kind of big groups of kids that are all kind of bopping around together. And so we don't necessarily want to do that. And it's also hard to predict how people are going to open the door, right? And so that's the hard part. So you go and ring the doorbell and you think, oh, of course they're going to have masks on. Not always, right? And we're getting real close sometimes, and lots of kind of talking back and forth. Trick or treat, I like your costume, that kind of stuff. Yeah. And so trying to avoid those situations. So I think it depends on how it's done. There's been lots of ideas about how to do things. If it's kind of Halloween parades or quiet family nights at home with different Halloween things. I kind of like Halloween. I wear a costume most of the week in clinic and those sorts of things and decorations. But yeah, trying to avoid those unpredictable, and really, as a parent, it's an uncontrolled situation,
Yeah.
right? So you
Yeah.
don't really know, and then once it happens, then
Yeah.
and there's not going to be any contact tracing with that, right? So
Right.
if somebody that you were trick or treating at their house and they were positive, you'll never know that,
Yeah.
likely. So
And you might think too, as I have, you might think, well, but they're kids and the risk of kids getting really sick is really low. It's not zero, but it's really low. But the problem with it really is what we're trying to do overall is, you hear the words, I'm almost sick of hearing them, is control the spread or whatever, stop the spread. And that's kind of what we're trying to do. And that's been the most frustrating part over the last number of weeks, is how we've been so crazy with positives. And that's because a lot of people are just very COVID fatigued, and they're saying, I'm just going to go about my life and let happen what happens. The only way we're going to be able to get back to some degree of normal is if we can get these numbers down super low, and then when there's a little uptick, we can stamp on that brush fire and deal with it. That's the only way we're going to be able to do this. And that may take a vaccine until the middle of next year, or we could probably do it sooner if everybody could just agree to watch out how they're doing things in close groups and things like that. So it's not just about, well, I'm not worried about my child getting sick. It's a bigger issue than that.
well, and Jim, you've been taking care of the people in the hospital
Yeah.
too, and I
well,
think,
yeah,
I think that's the big thing, is that, and that's what we worry about. And that's what we've been worried about from the beginning. If you have mild symptoms and you stay at home, okay,
Yeah.
right. It's when the hospital starts to get overwhelmed, and we've been there.
Exactly.
So,
And this is, even though the mortality rate is low, it's not zero by any means. In fact, since the last time we had one of these, we've had 3 fatalities in addition to the initial 3. So it's no laughing matter when it comes to that. Someone had a question that was really good, and I'm glad you asked it. I had a friend who was tested recently. It took a long time for her results to come back. She was told the machine was broke. Really, was the machine broke? So it's not so much that the machine is broke. So right now we have an analyzer. It's this big desktop thing, and it runs these tests. We do a combination of that analyzer. We have another analyzer that we have smaller amounts of supplies for, that we use for hospital admissions. So we can appropriately place people if they're positive or negative within the hospital. So what happens is this machine has been running 24/7 for weeks. And as you might imagine, if you take your car and you put your car and you floor it for a week, constant, something's going to break. And so that's kind of what happened. It didn't break, but one of the sensors or whatever went down, and you had to have service come in and deal with it. So it's a real complex situation with testing, and it has a lot to do with supplies for the testing. So I've pointed this out in the past, but as an example, let's say, I say to the company, okay, T2, here's a check. I want 100,000 testing kits, so I can test whoever I want. I want to do that. And T2, this is not actually true for T2, but the company may look back and say, oh, okay, thanks for that. You want 100,000, here's 30. And that's what they do. They call it allocation, because everyone in the country is in the same boat. And depending on the size and where you're located and the situation of the population right now, you may get more or less. So that's why we have a number of different ways in which we test. We're trying to do all that we can in-house. Some, though, have to go to a commercial lab that we said that our partners on in Green Bay, Purvey, HS, send them to the same lab. So that's kind of why it takes a while. No one's happy when that happens. It's very frustrating when it takes a long time. We really are hoping that by the end of November, we will have everything in-house, and we should be able to run things within 48 hours, if not sooner than that. So that's our goal and our hope, and we foresee that happening.
well, the hospital's investing in redundancy in terms of machines and those sorts of things. Some of it is even unpredictable, though. So, for example, I know last week. So we're pooling tests. So we do multiple tests together, and sometimes you just get a little unlucky. And one day last week, I know in the first 8 batches they ran, they had a positive in every single one. So then they had to go back and run all 40 of those samples all over again. So just inherent in that, you get a little bit backed up because the machine can only run so many samples. I mean, that's a finite number that you can run over a period of time. And there's a lot of intricacies and nuances with testing of which I don't appreciate all of what happens in the lab. But you just kind of continue to see, and sometimes there's those one-offs too, where a sample degrades quicker or the tube breaks, and that's going to happen no matter what. But certainly, from where we were 4 weeks ago to where we are now, it's we're doing a lot better of a job, a lot faster of turnaround. And I guess again, I'm a little bit my view is a little bit skewed because
you're spot on. Actually,
well, because the school age kids are getting tested a little bit more quickly because
right.
we are trying to give priority so we can keep that
right.
institution running. So.
Yeah, and it's also frustrating. Sometimes a husband and a wife will get tested at the same time, and I'll call the husband or the wife and say, "Yeah, you're positive." And what about my wife? And it may be 4 or 5 hours later that I would call the wife or get the results back for the wife. So. It's frustrating in that sense because I'd love to be able. Believe me, it would save me a phone call if I could just tell both people. So it's, So anyway, there's a couple questions on here. Of course, I made reference to the fatalities, and of course that everyone's curious. We're going to be having another Facebook Live at 6 o'clock with Sue Powers from Public Health. We're going to talk about all those things. What I kind of want to do is stick to the kids, families, and schools part of this. Not trying to evade those questions. I will absolutely answer them. But I'd like to, if we run out of questions here, then I'll try and get back to that. So let's see. If a child is hospitalized in Door County, can a parent stay with their child while in the hospital, or will the kids be sent out to a children's hospital somewhere else?
Yeah, so that's a really good question. Absolutely, parents can stay. That's always been our policy, and will continue to be our policy. Kids are obviously a very unique population, and so they're allowed. It would be one parent. In terms of the keeping them here versus sending them to Green Bay or sending them to Milwaukee, again, that's going to be an it depends situation. We've had this conversation. Some of it's going to depend on where we want to send the kiddo. Some of it's going to depend, meaning, do they even have beds, right? So so the situation at St. Vincent, for example, which would be the closest hospital that we would send out to, is they have a COVID unit, and so if it's related to COVID, then ideally we would put that child in the COVID unit. However, that is not on the same floor as the children's hospital where the pediatricians are. So if that child was particularly sick, there would probably be measures put in place to move them up to the children's floor where they could be monitored more closely. Some of it would depend on how sick the child is. So are we talking about we need just a small amount of oxygen, or is this child in significant distress, and are we dealing with some other things? Does the child have other issues going into the illness, which may be contributing to the need for hospitalization? So that is 100% case-by-case decision that'll be made, probably with myself, and then the referring hospital, the intensivist. So
yeah. And we had one of those situations. We didn't have to transfer the child, as it turned out, but Dr. Fogarty was on duty and was able to talk with the pediatric intensivist, and so that's one of the real benefits of having close partners is that we for every COVID, kids and adults, we have conversations with the intensive care doctors and infectious disease doctors down at St. Vincent on every case, because we want to, the reality is there's not a whole lot you're doing. I mean, there's a certain number of things you do when you're treating somebody with COVID, but nonetheless, you always run it by and make sure that there's nothing else that we could be doing and we are not. Linda asks, is there still a mask mandate for businesses? I think that goes through the first week of November, but I don't remember specifically. I think there is, but I don't remember specifically. Are people who test positive asked if they have followed guidelines like masks and distancing? That's a good question. Do you ask those?
I don't. Mostly because it does. I mean, at that point,
yeah.
I always ask, how are they doing?
Right.
But just in case there's additional guidance, because again, it hasn't so much been kids, but I'm talking on the phone and the mom is, can't get through a sentence and she's having trouble. And so talking about when to seek medical care for adults and making sure people are doing okay. But to me, in terms of asking about, those sorts of things, by that point, it doesn't much matter. point taken. Anecdotally, at least I would maybe have a little bit of a handle on if everybody I am calling was, not wearing masks or doing high risk activities, that kind of stuff. But
I've been asked that question too, and I don't do it now, and the main reason I don't do it is because it didn't occur to me when this whole thing started. It didn't occur to me to do that because someone said, "Hey, do you have data that show what percentage of people that are positive were wearing masks and not wearing masks?" And I sort of like that would have been a great piece of information to know, but that would have required starting at the beginning and having the presence of mind, which obviously I didn't have, to start asking those questions. And so now, this far into it, I mean, after 800 cases or whatever positives, it's sort of irrelevant. But it's a good question, and as I say, I kick myself on a pretty frequent basis because it would have been, if nothing else, just an interesting case study to sort of see what is actually the incidence. We know for sure, though, in talking with public health and our colleagues in Green Bay, really this present surge is really driven by people getting together in groups, weddings, family reunions. The people are still pretty insistent about going to the bars, and so none of this is, for those of us that do this every day, none of this is a surprise. So if someone says, and I've heard it, and I sort of make a little light of it because I often say, if you can't laugh, you cry. But people will say, well, gosh, I've been so careful. I've been wearing masks and I've been staying home. We've been so careful. We went to the casino last week just for about 7 hours. But other than that, we've been so careful. And I think a lot of people just innocently, it's just they don't think about that. It's like, well, you were in a casino with terrible ventilation, close together. Maybe you were wearing masks or not. As you were having your cocktail, you probably had your mask off. It does not take long because the virus, if you think of the virus, I mean, they obviously have no cognition. But if you think of the virus as a little bug that's out there thinking through this, it's looking for ways to get from person to person. It's looking for ways to infect the next person because that's how it propagates and that's how it lives. So where it can, it will do that. That's what their RNA is designed to do, and they're great little hunters as far as finding the opportunity to get in somewhere, which is why masks are such a decent thing because, can it get through this? Sure, but the odds are good it won't. So let's see if you have any other questions now that I'm done talking here somewhere. No more questions right now. Anything else we should talk about? I'm trying to think. Well,
I know opening a little bit of a can of worms is the winter sports discussion, which has started among schools. And I know schools are making hard decisions, just like they were with fall sports, about what to reopen, and really trying, the schools are working very, very hard to balance the risk of COVID along with the risk of not doing extracurricular things and the impact that has on particularly teenagers we're talking about. So we're talking about high school sports and people that are in senior year and that already missed junior prom and these sorts of things. And I don't know that I have a perfect answer. There's not going to be a perfect answer, right? No. The discussions are ongoing, and I think that there's a few things that we know are going to increase the risk. Winter sports are very different than all the other seasons because they are all indoors. So specifically, we're talking about basketball and wrestling for the schools up here. They're indoors. They're physically demanding sports, meaning that people are going to be breathing hard, right? And they're close contact. I mean, you can't play basketball without being. I mean, I can't play basketball doing this, right? And so, very different than where we were with fall sports, where golf, tennis, cross country, and if you look at probably the closest comparison, you look at volleyball. That was a tough one. So, schools are each school district is going to make their own decision about, just like they did with opening of schools, based on, and some of it may be just logistics, right? So is your coach also a teacher, or is your whole coaching staff on your teaching staff, right? And so a positive on the basketball team is going to wipe out half the high school or whatever. Right. And so I just want everybody to know that, just like with every other decision that's been made with the schools, and I've been involved in all of those decisions. The administrations are working so hard to try to give everybody the best experience, but still be able to have that primary goal of in-person instruction. And not wavering from that as being the primary goal, and having other things as, well, they're extracurricular, right? That's why they're called that, right? So we have to get our curricular activities done, and then we can start to look at the extracurricular activities. But they're all working real hard, and I know the meetings are ongoing. I've been asked to be part of some of those meetings, and hopefully we're going to end up in a good spot. And just like with everything else, we don't know what the right answer is going to be.
Right.
So it's not a bad thing to have different approaches in some ways, because if everybody does the exact same thing, we won't know if that's the right choice or not.
Right.
And obviously, those choices can help guide us based on what people's experience is. So we'll have to see. More to come on the winter sports for sure. But
all right, let's see. So I want to go back, just to clarify. Someone has sort of said, I'm confused, number of deaths. The data currently says 4, and that's right. It just hasn't been updated, so that we had one more death at this facility, and then we had one Door County resident who was transferred to Green Bay and passed away there, unfortunately. So that's the additional 2. And people always want to know, do they have underlying conditions, comorbidities, things like that. And I think without exception, the answer is always yes in this age bracket. So they're elderly for the most part, and so you always have that. Someone else asked about the census in the hospital. Is the staff strained? I think we're in a much better place now than we were a week and a half ago. You may have heard me say in other venues that we had 31 patients in our 25-bed hospital, which is the most that's ever been in this hospital, because it's licensed for 25 beds, but that licensure has been waived in these situations, and so we're doing way better now. I think that's a really apt question. Is staff strained? I think that's the big issue with this. As people always say, well, how many rooms do you have, or how many beds do you have? Back at the beginning of this, it was how many ventilators do you have? And all those questions are good questions, but in the end, they miss the point. It's okay, I can have so many beds, but do I have people to actually take care of people that are in the beds? Do I have people that actually can run the ventilators? And so staffing is the biggest problem everywhere, not just here. But as far as right now, what I don't want people to do is get the idea that you're not going to be taken care of if you need to come here. At this point, we're in good shape, but that is the reason why we really ask people to take this seriously and not congregate and not do some of these things, and please wear masks, is because what can happen is, even if you've got an emergency room or a hospital full of COVID patients that aren't necessarily all that sick, but they're sick enough to be in the hospital and taking up beds, then if you have a heart attack or if you have some other problem that requires hospitalization, we may not be able to treat it as rapidly or as effectively as we otherwise could. And that's what we're trying to avoid. Let's see. If kids are swimming with a chlorine, protect them.
Well, not necessarily with airborne or droplet viruses, right? So, I guess, if you want to talk about like coughing under water,
I think the big thing
or
is,
just in the air.
I think it's more if kids are swimming with the chlorine I don't think will protect them.
No.
But I think, it's the same thing. It's droplets. So if you're able to swim and keep a distance, I think you're in reasonable shape. I think there was some concern early on. A lot of pools closed, hotel pools, the Y pools, things like that, and the whole thing of spit getting in the pool and spreading that way, that turned out to be a big nothing.
Yep.
So I think DCY Swim is operating, and they're doing real well, and they're in groups well separated. So I think that's not a problem.
Well, and swimming is something you can do distanced, right? So again, different than even running like a swim practice, right? You can stagger people in lanes and have one go one way and one the other way, where there's very limited contact at all. It's a much more individual, kind of isolated sport. So
maybe you can take this one too.
Sure.
This is good for the holidays coming up. Is it safe to wear a mask and stay 6 feet apart in your house as well as outside? So it's basically, I think what you're asking is it okay to wear a mask and be 6 feet apart in a home? Let's just say, for the sake of argument, Thanksgiving.
Yeah.
How
Certainly,
would you-
I mean, it would be helpful, but at least when I go to holiday gatherings, I tend to eat.
Yes, there's that.
So that's hard to do, and again, it's risk reducing, right? Is it going to be 100%? No. Certainly, would it be helpful? Yes. We know that, and trying to say, grouping family units in certain areas if you're eating and those sorts of things. There's certainly behavior things that you can do to modify those kinds of activities. It's a lot of times, though, what I'm ending up seeing or hearing about is exactly what you had talked about. We stayed, except when we were standing at the buffet table and getting chicken together or whatever it was, and then we were eating and I took my mask down because whatever, and so it's often just those 95, 97% of the time we're doing the things that we're supposed to be doing, and then it's just the short period of time sometimes that you're not even maybe thinking about, that can be difficult, and that's the hard part about those family gatherings. They're typically long, and
I mean, the perfect storm for this virus is being close together in an enclosed space with poor ventilation, and so if you have those things, an unfettered spread, like no masks and things like that. So I think this year, Thanksgiving and Christmas could potentially be a bummer for people. I think the thing is going to be to remember that this is just this year, and I think once we get past this, it won't be an issue. But I know, as I keep using myself as an example, but my parents are 81 years old. My mother has a chronic lung condition, and I've had this conversation with her, and she's not happy about it at all. But I said, we will come and visit around Christmas, but we will not be there on Christmas Day for the whole dinner thing, because we're just not doing that, because it doesn't make sense, and the risk to my parents is high. And if they were to get COVID inadvertently with my mother, that'd be all she wrote. So I think that's, but I think when you mention the 6 feet apart, wearing masks, that's at least a good start. I mean, and life is not without risk. And so if you deem that you've got a family that's pretty healthy, you may choose to take that risk, but it's not going to be risk-free at all. So
I mean, often we can only use ourselves as examples, but
right.
I was just saying before this, my mom typically hosts Christmas, and she said, what do you think about that? And I said, grown up, you can do what you want, but I will not be there. And this
right.
is family, this is the twice a year. I mean, I've had Christmas Day with my mom's family since I was born. I mean, that's the deal, right?
Exactly.
And so hard decisions,
They are.
and hoping that we'll be able to do it in a better spot. But at the same time, I mean, I take care of patients, and you take care of patients, and understanding too that, in some ways, I know that, and not everybody has our risk either. But at the same time, if it turns out that it was me that gave it to you gave it to, I mean, it's something that you would never probably, I mean, I wouldn't ever get over.
Yeah.
And so really playing that out, and that's what I've been asking families to do. If this ends up in a 24-day quarantine, was that going to be worth it? If this ends up with me giving this to my mom or my grandma, because that's typically the people that I'm talking to, is that going to be worth it? And yes, the risk is small, and you could play that with a lot of things, right? You could play that with a lot of things. But at the same time, this is kind of a measure. This is obviously a very different situation, and something that.
And I think the point of this conversation too is I think very often people will hear those in a position of authority say, you should not do this, you should not do this, and I think just understanding that these are not the easiest questions to answer, and I think you just have to think through them. And we can give you our best advice, but in the end, and if giving you our examples is helpful, that's terrific. But in the end, you just have to sort of decide, you know. Yeah, and I think this is not going to be the most pleasant. I mean, I say that, but you know, there's part of me is sort of looking forward to being able to spend some quality time just with my family, which is just my wife and my son. You know, but I'm looking forward to that because normally you're running around. You know, we have family all in Milwaukee, so we're running around down there for 3 days to deal with Christmas, and so in that sense, it'll be rather nice. The other thing too that's important to know, and I think most people are aware of it, but I think recognize too that when we talk about what's a safe group to be in, the safe group to be in is the people with whom you live. It's not, well, these are my relatives. I mean, they're my brother, my sister, whatever. That doesn't matter. I mean, if they live somewhere else and are coming to you, they could have it and not know it. So it has nothing to do with being related. It has to do with who is living with you in your home, and that's the group that's safe. Everything else is a possibility for introducing infection.
Right.
Let's see. When will all the COVID testing also have influenza testing in the same swab? Hopefully by the end of November is our hope. We have that instrument is coming and we'll have that. Someone asked the question, well, here's a good one. How serious a complication is asthma for children and COVID?
I mean, again, it's hard to say. Again, even my patients that have asthma, so I've had those that I've called, they're surprising. I mean, they're really not even having significant asthma issues, you know, where they've said, oh, I'm puffing on my albuterol, or any of those sorts of things. I have not had any of the positives up here that we've had to, you know, even with what you consider to be kind of a traditional asthma exacerbation, where you're talking about, you know, we need to do oral steroids or more frequent albuterol or change daily medicines or those sorts of things. We have it. And you know, part of that is, I mean, no, we don't have thousands of kids, right? And so yes, it is a complication. Yes, it can make it worse. But you know, even my kids that have asthma have been doing okay.
Do you have any idea of college? The question is, are colleges staying open for kids? Any idea?
Yeah, I mean, most of them around here. So it's been kind of interesting. It's been very much like what our school districts went through, where it was a rough first couple of weeks. So my husband actually works down at St. Norbert, so I can speak to that one probably locally better than some of the others. And they had a real rough go for a while. They did. They had the Crest Inn down there, and they actually had part of Tundra Lodge where they were quarantining. And again, I think it's people really recognizing that your own personal action really has huge downstream effects. And they did put a curfew in place, and they've kind of been cracking down on restrictions and regulations. They do not do routine testing like some of the other colleges are doing. And they've been, you know, it's a relatively small college, but they've been actually doing very, very well over the last couple of weeks. Yeah. Again, very much like our school systems. You know, you have little tiny spots, but once people really started to understand, you know, we're going to have to give up some of that traditional college experience, the weekends and that kind of stuff. It seems to have gotten better, and that's a story that's played out. So I graduated from Vanderbilt, so did my husband, so we've kind of followed down there. He also graduated from the University of Illinois. They have kind of the very interesting kind of cutting edge sorts of testing that they're doing. And that's sort of been a story that's played out for those colleges that were able to get through that initial part, which the ability to get through was variable. They all seem to be doing much better now.
Well, it's kind of the concept too of the like the NBA bubble down at Disney. You know, and when you talk about the bubble, I mean, the concept is you either have the ability to test everybody and make sure everyone's negative, and then you put them in this bubble and you stay there. I think it's the same thing in the university campuses. Initially, you have people that come and they have COVID, and you got to isolate them somewhere else. Once they've gotten through that, and then you're back together, if there's no virus to be spread around, it's not going to be spread around, and you can move on about your business. It's kind of like, that's almost, if people would think about that as a microcosm for what we want for society in general, if we can tamp this down and don't give the virus anywhere to go, then we can keep going. We can, you know, and so that's kind of what's, I think, happening in the universities now. So it's all good stuff.
Yeah, it is.
Well, you know, I think we're going to have to, we've got to get ready for our 6 o'clock adult-focused.
Right. And they don't have anything interesting to say about that.
That's right. So So I do want to real quickly, just one more question that I think, and I think we've hit them all. One person said, do we recommend wearing a mask while horseback riding with a few people? I think as long as you're far enough away, if you're outside, you don't have to wear a mask. And then someone asked, what's the risk after someone has had COVID? If I understand this correctly, does the person who have had COVID get tested after 30 days? We don't retest once you've had COVID. We don't retest. The reason is because it's very possible that to retest would pick up dead virus, and it would say positive when in fact you're not. There have been a few case reports that have come out of late about people that have been reinfected with COVID. Those are pretty low numbers. So right now we don't really have a great idea of what the immunity is as far as after someone has COVID, but as Dr. Fogarty said, CDC is kind of operating under the basis that 90 days at least we assume there's some degree of immunity. So that doesn't mean you go out and live your life with impunity and stop the mask and go party hardy. You still do those hygienic measures, the masking and the distancing and things like that, but the odds of you getting it again within 90 days are pretty low. So any last words?
No, I mean, I don't think so. I'm always happy to kind of chat about how things are going, and again, pleased with where things are. And I know I had talked to the superintendents before we had started this and asked if there were things that they wanted me to highlight, and they wanted me to convey to all of you that they are also very grateful for all of the choices and the participation in making all of the right choices. Again, as we are at the hospital and continuing to work together as a community the best we can, because we know that each of those individual decisions really adds up one way or the other, so that we can try and keep going.
Yeah, and I have to say it's been really gratifying to my small part. Dr. Fogarty has been heavily involved, working with the school districts as far as trying to be a resource and watching them work through this very complex situation. It's been so impressive to see how all the districts have come together and have really worked this out so well. So kudos to that. I think we're all really fortunate to live in this community in this county. So with that, thank you all so much for joining us, and thank you for the questions. We appreciate it. I wish you all the best, and please stay well.